Thank you, Senator. In the bipartisan infrastructure law, Ms. Fox, Congress committed to ensure that disadvantaged communities benefit from federal drinking water and wastewater infrastructure investments. The Biden administration has made the same pledge through its Justice 40 initiative. State policies such as project ranking systems and additional eligibility criteria can create barriers to disadvantaged and underserved communities' ability to access funds. Here's my question. Is EPA tracking these state-level barriers? And what is the agency's plan to help communities overcome these barriers so that they can access federal investment in water infrastructure?
Thank you for that question. And yes, Senator, we are tracking those barriers and working actively with individual states as well as with CIFA, the Council of Infrastructure Financing Authorities, to collaboratively develop solutions to those barriers. I think the states and EPA, we share a commitment to making sure that we make these resources available to as many communities as possible. And things like the project, ranking system, it is a barrier in some states. There's other barriers that exist as well. For example, we have some states, for example, have only an annual application process, while other states allow for multiple rounds of submission of SRFs. That's another thing. I think there's challenges around local communities knowing when to apply and having full transparency into that process. So there are a range of barriers, as there are with many funding and financing programs across the federal government. And so we are very closely partnering with the states to work through those together. And one thing I can also say is there's an incredible amount of peer exchange and learning that's happening right now across states. There's trainings and opportunities for the states to come together to learn from one another, and we want to support and encourage that as much as possible as well.
All right, thank you. One of the Biden administration's priorities has been to replace lead service lines. The bipartisan infrastructure law included, I think it was $15 billion in funding for full lead service line replacements. A lot of money. In the years leading up to the passage of that law, we heard from several states, including my own state of Delaware, that the prevalence of lead service lines was not a significant problem. However, as some of those states started doing lead inventories, it became clear that the presence of lead pipes and the health impacts they cause is more pervasive than a lot of folks expected. Question, given this initial skepticism, have the states been able to use the funding for lead service line replacements?
So I think one of the most exciting aspects of this job and serving in this capacity is to help deliver on President Biden's commitment to get the lead out once and for all. Just so remarkable, the president's leadership on this issue. And, at the EPA, we are using every tool in our toolbox to deliver on that. As it relates to your question, Senator, the reaction is mixed. There are some states that feel that their allocation of lead service line money is insufficient for the need. Others think that the allocation is too much, given how much the need is there. So we're in constant conversation with the states to understand that. We do have what's called a reallotment process that we can utilize, so that after 2 years, if a state doesn't use their lead service line money, we can reallocate it to a state that could use it. So right now, we're in the process of working with the states to make sure that they know they can use this money to support, the inventory development, because that's the first thing to really understand the nature of and scope of the problem, to start those replacement projects. But then, yes, after those 2 years, if states don't utilize those resources, we will be able to reallocate.
All right, thank you. My last question to you today deals with the private wells. My family grew up in West Virginia and largely in Virginia. We always had private wells, and I think a lot of folks around the country still do. and a lot of folks are having private wells drilled for them and for their families and their farms in some cases. The presence of contaminated private well water is becoming a problem nationwide. As you know, in Delaware, we know that about 173,000 residents depend on private wells. Most people think we don't have that many people in Delaware, but we do. We got 1 million people now, and there's about 173,000 residents who depend on private wells for their drinking water. This number is actually growing, not shrinking. Congress included language in the Drinking Water and Wastewater Infrastructure Act to allow EPA to give grants to states to address underground sources of contamination impacting wells. Unfortunately, EPA has determined it cannot implement the language except to connect homeowners to a regulated water utility, which, as you know, is not always feasible. Because wells are managed by the states, Congress does not expect EPA to take on the regulation of wells under the Safe Drinking Water Act. Having said that, Congress did expect EPA to help states address these sources of contaminated drinking water. I'm just going to ask if you would be willing to commit today to working with this committee on Environment and Public Works to help address well contamination by providing resources to states.
Absolutely commit to that. This is a shared concern around protecting public health, and happy to work more closely with this committee on this issue moving forward.
All right. Is there any question you wish you had been asked that you have not been asked? This is a freebie. What do you wish you'd been
Well,
asked?
my
that you were
favorite
not
question
asked?
to ask people is, what's your favorite body of water?
All right. Now that I'm the only one here, I mean, what would that be?
The Pacific Ocean.
No kidding. That's great. Well, that's hard to argue with that one. Hard to argue with that one. Okay. I think that's it for my questions for you today. I just want to thank you again for being here, for your responses, and for the work that's gone on. Just to convey to your team our thanks, especially for the work on permanent chemicals. That's one that's of great importance to the ranking member and me, and I think to all of us. I tell the story, and with this we'll close and move to the next panel. I spent a lot of my life in airplanes, Navy airplanes, and I literally witnessed a terrible tragedy at Moffett Field Naval Air Station when I was on active duty, when we had 2 runways, side-by-side parallel runways, and we shared the base with NASA airplanes. And our P-3s were a smaller 4-engine airplane, but not as big as the ones that NASA flew. And early one morning, 2 planes were coming down to land simultaneously on the 2 parallel runways. Navy P-3 on the right, a NASA aircraft, larger aircraft on the left. Both planes were cleared to land, as it turned out, on the same runway. And the large NASA plane crushed the P-3 and killed about 18 people. Firefighters rushed out to try to save the lives. 18 people died. About 20 years later, I'm driving in Delaware, living in Delaware, driving down Route 13, heading, or actually to Route 1, heading for Rehoboth, in that area. And I go by, approaching the Dover Air Force Base, which is on the left as you head south on Route 1. And I could see black smoke coming up from the Air Force Base. And a C-5, which is a huge aircraft, C-5 cargo plane, which is fully loaded with gas and fuel, and cargo had tried to take off from Dover Air Force Base. And in the climb out to altitude, the flight engine, they have four engines on the C-5, and they got an engine warning light on one of the 4 engines. The flight engineer shut down the wrong engine, so instead of having 4 engines working, they had 2. They had a full bag of fuel, fully loaded, and they tried to come around and land on the runway before they lost all their altitude. They didn't make it, and they went in about a mile south of the approach end of the runway. All the firefighters coming out from all over the Dover Air Force Base just came out, covered the plane with foam, saved every life. And that's the good news. The bad news is in the wake of that, we have 4 communities around Dover Air Force Base who have contaminated water, drinking water. So something that was literally intended to save lives has, as it turns out, inhibited the quality of life. And we're still dealing with that in Delaware. We're dealing with it in West Virginia, and just very pleased with the attention that the issue has received, and hopefully will continue to receive. Again, thank you very much. Senator Capito, anything else you want to say before? Thank you. All right, thank you so much. And with that, we'll welcome our second panel. Thank you, ma'am.